Hey there everyone, in the previous video we had studied about the popliteal fossa, and in today's video we are going to start with the back of thigh. Okay, we are going to study the back of thigh. So the back of the thigh, it is also known as the posterior compartment and also known as the flexor compartment. Okay, in the arm, in the upper limb, we had seen that the anterior compartment is the flexor compartment and posterior compartment is the extensor compartment. But in the lower limb, this is about the upper limb, but in the lower limb it is quite opposite. Okay, so the back of the thigh, that is the posterior, it is the flexor compartment. Okay, we are studying the posterior compartment today. So we are going to study the intermuscular septum first. Intermuscular septa, we have already studied this septum in the introduction to the lower limb chapter. I will link it down in the description box. You can check it if you haven't seen that yet. I have explained it well and with the use of mnemonics as well. Okay, so this is the anterior. Okay, the thigh, it is divided into three compartments: anterior compartment, posterior compartment and the medial compartment. Okay, anterior, posterior and medial. So we are studying the posterior compartment today. So it is separated by the posterior compartment is separated by the medial compartment by the posterior intermuscular septum and by the anterior compartment okay, from the anterior compartment by the anterior intermuscular septum. Okay, so this is about it. The posterior compartment, it is separated from the medial by which, okay, by posterior intermuscular septum, P and P. Okay, posterior intermuscular septum. Now adductor magnus is a hybrid muscle. A point to be noted, it is a hybrid muscle. It is a component of both these compartments. Okay, which compartments? One is the medial compartment and the posterior compartment of the thigh. This adductor magnus is the component of both these compartments because of its location and because of its action. Okay, so the back of the thigh muscles, okay, the muscles of these back of the thigh, they are also called as the hamstring muscles. Okay, they're also called as the hamstring muscles. We're going to study about the origin, insertion, nerve supply and action of these muscles in next video, but we are going to study everything except muscles in this chapter, in this video. Okay, so now what are the sensory innervations of the back of the thigh? So there are four. Okay, remember there are four nerve innervations. So one is the posterior cutaneous nerve of thigh. Of course, we're studying the posterior compartment, so it is obvious that it is supplied by the posterior cutaneous nerve of thigh. Cutaneous branch of the obturator nerve. Okay, the obturator nerve. We know that the femoral nerve and the obturator nerve come from the same root in the lumbar plexus. We have already completed the lumbar plexus in a very easy way. I'll link it down in the description. Please check it out. Okay, the medial branch of the anterior cutaneous nerve of thigh. Okay, the anterior cutaneous nerve of thigh, suppose this is the anterior cutaneous nerve of thigh, is the medial branch. So this is lateral, this is medial. This medial branch, it also supplies on the posterior side or the back of the thigh. Okay, the lateral cutaneous nerve of thigh, see, the anterior cutaneous nerve of thigh as well as the lateral cutaneous nerve of thigh. Anterior cutaneous nerve of thigh का कौन सा branch? Medial branch. And the obturator nerve का कौन सा branch? Again cutaneous branch. And the posterior cutaneous nerve of thigh. So these are the sensory innervation or the nerve innervations. They are four in number: posterior cutaneous nerve of thigh, cutaneous branch of obturator nerve, medial branch of anterior cutaneous nerve of thigh, and lateral cutaneous nerve of thigh. Now the most important, very important nerve, that is the sciatic nerve or the sciatic nerve. Okay, this is the thickest nerve in the body. Okay, it is the thickest nerve in the body. We had also studied this in the introductory part of this chapter, we of the lower limb. Please check that video out. So see, it is the thickest nerve in the body, around 2 centimeter wide in the upper parts. Okay, it is the largest branch of the lumbosacral plexus. If you don't know that, we have covered the whole complete lumbosacral plexus in 5 minutes, only in 5 minutes. I'll link it out in the description box. You can check it out. Okay, so Yeah, so let's see the root value first. Okay, we'll see the root value. Okay, so the root value, this is L4, L5, S1, S2 and S3. This, see, the sciatic nerve, it has two parts, tibial part and the common peroneal part. Okay, the tibial part and the common peroneal part. Tibial part is the greater part, and the common peroneal is the lesser or like smaller part. Okay, so see now, common peroneal nerve from L4, L5, S1 and S2. Okay, from 4, L4, L5, S1 and S2 on the dorsal side is the common peroneal nerve. Dorsal is also called as posterior, right? So P for peroneal, P for posterior. So common peroneal nerve on the posterior or the dorsal side, and the tibial nerve is on the ventral side. Of course, एक पीछे एक dorsal के side पे है तो एक ventral के side पे रहेगा. So it is from L4, L5, S1, S2 and S3. So it is from 5 roots, and the common peroneal is from the 4 roots. Okay, L4, L5, S1, S2 is the common peroneal nerve, L4, L5, S1, S2, S3 is the tibial nerve on the ventral side, and common peroneal nerve on the posterior side, because of a P for posterior, P for peroneal. Okay, so see, it is about the peroneal and tibial nerve, and these both together is the sciatic. Oh my god. Okay, is both together is the sciatic nerve. Okay, sciatic nerve. Okay, anterior primary rami. Okay, anterior primary rami of ventral division is the tibial nerve, dorsal division is the common peroneal nerve. So this is about the root value of both the nerves. Now we saw this is the thickest nerve. Now we will see the beginning. It is in the pelvis. Okay, it begins in the pelvis, and its termination is superior angle of the popliteal fossa. We have studied the popliteal fossa in detail without missing even a line from textbook. You can go check that out. So see, popliteal fossa is a diamond shaped fossa. It terminates by dividing into two nerves, that is the tibial nerve and the common peroneal nerve. Okay, tibial nerve and the common peroneal, superior surface of the popliteal fossa, superior angle of the popliteal fossa, that is the tibial nerve and common peroneal nerve. Okay, so we saw the root value, the course, the beginning and termination. Now we'll see the course in detail. Okay, the course is in 3 regions, that is the pelvis region or the pelvic region, gluteal region and in the thigh region. Okay, so see, it lies, okay, where does it where is it course? Okay, how do we trace it? So it lies in front of the piriformis muscle and its fascia. See, it is a key muscle. Okay, piriformis muscle is a key muscle in the gluteal region. So see, it is the piriformis muscle and its fascia. It lies in front of the muscle. So suppose this is the hip joint or the hip bone, and this is the femur. So this, whatever you see here, this is the piriformis muscle, and this yellow one is the sciatic nerve, and it is descending downward in front of the piriformis muscle. So this is in the pelvis, and now in the gluteal region it enters through the greater sciatic foramen. We have studied in the introductory chapter again the surface landmarks we have seen. So see, this is the greater sciatic. We have lesser sciatic also. See, okay, so see, G for gluteal, G for greater, okay, and G for greater truncator and G for greater foramen, and G for gluteal region. This is how you remember, that is G cube. Okay, G cube. So G for gluteal region, G for greater foramen, sciatic foramen, and greater trochanter of the femur. So move slightly laterally between ischial tuberosity and the greater trochanter. Okay, laterally, if you imagine a hip bone, you see that on the lateral side we have the ischial tuberosity and the greater trochanter. So this is the core. See, from the greater trochanter, sorry, the greater sciatic foramen, it is descending downwards and it is going laterally downwards near the ischial tuberosity and the greater trochanter of the femur. So this is in the gluteal region. How to remember it? G cube. Okay, now in the thigh, it enters the base of the thigh at the lower border of the gluteus maximus muscle. Okay, the gluteus maximus muscle. So there are a lot of structures that are present underneath the gluteus maximus muscle. So see, it is passing through the lower border of the gluteus maximus muscle at the superior angle of the popliteal fossa. It divides into the tibial nerve and the common peroneal nerve. We have already seen that. That is upper 2/3 and lower 1/3. Okay, see, it's divided into 3 parts. 3 parts, that is 1, 2 and 3. So this 2/3 is the upper part and 1/3 is the lower part. Okay, now gluteus maximus. Suppose this is a gluteus maximus muscle, lower border of the gluteus maximus muscle, and then it descends till the popliteal fossa, superior angle. Then it divides as it divides into tibial and the common peroneal. See, this is the popliteal fossa, diamond shaped fossa. Check the video out of the complete popliteal fossa. I'll link it in the description box. So this is the sciatic nerve, divides into the tibial nerve and the common peroneal nerve, tibial and the common peroneal nerve. So we are done with the courses, that is in the pelvis, in the gluteal region, in the thigh. How to remember gluteal region? G cube. How to remember the pelvis? It is the key muscle के सामने से आ रहा है, that is a piriformis muscle, and in the thigh gluteus maximus muscle के पीछे से आ रहा है, and it is at the popliteal fossa. It is dividing into the tibial nerve and the and the common peroneal nerve. Now we are going to see the relations. Okay, the relations are not in the pelvis, so we are going to study the relations mostly basically in the gluteal region and in the thigh region. Okay, so in the gluteal region, superficially or posterior, deep or anterior. Why superficially posterior, deep anterior? We have already studied this, okay, in the popliteal fossa chapter itself. Okay, so see why posterior means posterior. See, suppose this is the popliteal fossa. You can, if you touch your fossa, if you touch the fossa, you can feel it. It's superficial, but in the knee joint there is a capsule, right? It is present, okay, on the anterior surface of the knee. Okay, we have this deep, or it is anterior, it is deep, right? And posteriorly you can feel it. So this is how you just remember it. Okay, so superficially we have the gluteus maximus muscle, as we have already discussed in the glutes. Okay, in the glute region we have the gluteus maximus muscle, and it pierces the glute, not pierces, but it is running from the lower border like that. So see, suppose this is the gluteus maximus muscle. This diagram I think is not actually the way it should be, so I'll show you how. Okay, suppose this is the gluteus maximus muscle and this is the lower border, and this is how the sciatic nerve, okay, the sciatic nerve, it has to pass, okay, laterally it is going, right? So this is how it is. And deep or anterior, we have the body of the ischium, tendon of the obturator internus with its gemini and obturator externus, and the quadratus femoris. One important point to note that we all make blunders is it is not quadriceps femoris, it is quadratus femoris. Quadriceps femoris is a muscle of the, yeah, tell me which muscle, which compartment muscle? It is the front of the thigh muscle. Okay, front of the thigh muscle. It has four heads: the vastus lateralis, medialis, intermedialis, and the rectus femoris. So it is not quadriceps, it is quadratus. Okay, the quadratus femoris, capsule of the hip joint, and fibers of the adductor magnus, because we know that it is a hybrid muscle. It is a hybrid muscle. It is also on the medial side and on the posterior side also, acting as a hamstring, and the medial side acting as the adductor. Okay, naam nahi hai na, adductor magnus. So see, okay, on the deep or the anterior we have the ischium, the obturator muscles, internus and externus, both the quadriceps femoris, the capsule of hip joint, and the fibers of the adductor magnus muscle. Now we are going to see medially, okay, in the gluteal region, medially by the inferior gluteal nerve and its vessels. Okay, inferior gluteal nerve and its vessels. See, the common iliac artery divides into external and internal. So the internal, it gives off a branch for superior and the inferior. So it is the inferior gluteal nerves and the inferior gluteal vessels, that is the artery and the vein. So see, this is the gluteal artery, gluteal vein, gluteal nerve, inferior. Okay, all are inferior, and this is the sciatic nerve. Okay, sciatic nerve. So it is medial to these, medially, the location, the relation, okay, in the medial side it is like this. Now we're going to study in the thigh, superior, deep, medial, lateral. In the glute we had superior, deep and medial, but in the thigh we have superior, deep, medial and lateral, all four. See, superiorly we have long head of the biceps femoris muscle in the thigh, right? So posteriorly or superiorly we have the biceps femoris, right? It is a hamstrings muscle, the long head of the biceps femoris. Deep or anterior we have the adductor magnus muscle, This is a very important muscle, okay, very important muscle. So anteriorly we have the adductor magnus. Just picture it in your mind, okay, just create diagrams in your mind so that it will be much more easier to remember for longer period of time, because I believe in pictorial memory. So see, this is the biceps femoris, the adductor magnus on the deep or the anterior side. On the medial side we have semimembranosus and the semitendinosus muscle. Lateral side is the biceps femoris again. This is the short head and that one was the long head, okay. Superiorly by the long head of biceps femoris, deep by the adductor magnus, very important. Medially by the semimembranosus and the semitendinosus. See, medially में I आ रहा है तो semi में भी I आ रहा है, right? So it's semimembranosus and semitendinosus. Laterally we have the biceps femoris का short head, okay, biceps femoris का short head. So these are the relations. Now we are going to see the branches, okay, we are going to see the branches, okay. So see, this is the sciatic nerve. So this is sciatic nerve, L4, L5, S1, S2, S3. L4, L5, S1, S2 for the common peroneal nerve, L4, S5, S1, S2, S3 for the tibial nerve. Altogether is the sciatic nerve. So see, the more matlab ज़्यादा है, that is the tibial nerve, and less is the common peroneal. So this one is the tibial and this one is the common peroneal. See, the tibial nerves gives off supplies, okay, branches of it are the semitendinosus to the semimembranosus, long head of the biceps femoris, hamstring part of the adductor magnus, okay. So through the long or great sciatic nerve, okay, long head of biceps femoris, okay, by through this. And on the common peroneal nerve we have only one supplication, or like not supplication, I mean it's supplying to, or it is giving off branches to only one, that is a short head of the biceps femoris and the superior angle of the popliteal fossa. So this diamond shaped is the popliteal fossa. So it is a superior angle and it gives off branches, it divides, that is the tibial nerve and the common peroneal nerve, okay. So the tibial nerve, L4, L5, S1, S2, S3. So there are 1, 2, 3, 4, 5 roots, and it has 1, 2, 3, 4, and 4 it supplies to 4 regions, okay. So remember, it is more, and this is also more. Common peroneal nerve has 4 roots and it gives off only one branch. So remember, it is in this way: semitendinosus, semimembranosus, lateral long head of the biceps femoris, hamstring part of the adductor magnus, and short head of the biceps femoris muscle. So it divides in the common peroneal and the tibial on the superior angle of the popliteal fossa. Now what is this? Okay, so this is an important term, okay, that is the arterii nervi ischiadicae. I don't know how to actually pronounce it, but okay. So this is sciatic nerve and this is the inferior gluteal nerve. It gives us a small branch. It is accompanying with the the sciatic nerve. So it is called as the arterii nervae ischiadicae, however you pronounce it, okay. This can be asked in the MCQ as well. Just remember this, just go through it once in the textbook, okay. Now arteries of the back of the thigh, abhi thoda hi bachaya chapter. Arteries of the back of the thigh, okay. So we have the profunda femoris artery, a branch of the femoral artery, the chief branch of the femoral artery, the medial circumflex femoral artery, and the lateral circumflex femoral artery. All these three are the branches of the femoral artery. We'll see in the diagram downside. So see, the profunda femoris artery, it gives off perforating branches. How many? 4 perforating branches: first, second, third, fourth. So the first is near the upper part of the adductor brevis, upper border of the adductor brevis. Second is through the adductor brevis. Third is the lower border of the adductor brevis, and it is the termination of the artery. So remember, adductor brevis, okay, we saw adductor magnus, now we see adductor brevis, okay. So see, first one is upper border of the adductor brevis, uske baad through the adductor brevis, then the lower border of the adductor brevis, and fourth is the termination. Now the medial circumflex femoral artery, it gives of 3 branches: ascending, transverse, and acetabular, okay. And the lateral gives of 3 branches: ascending, transverse, and descending, okay. Remember this. Now we will see it in a diagrammatic way. We will see the truncating anastomosis as well as the cruciate anastomosis and the longitudinal anastomosis, okay. So see, this is the abdominal aorta, then the common iliac artery continues as the common iliac artery, divides into the right iliac artery and the left iliac artery, right and left iliac artery. It continues and divides as the external iliac artery and the internal iliac artery, okay. External iliac artery, internal iliac artery. Near the inguinal ligament, the external iliac artery continues as the femoral artery. Now it gives off a chief branch, that is the profunda femoris artery. It gives off 4 perforating branches, right? So see, this is the first, this is second, this is the third, this is the fourth perforating branches, and these branches give ascending and descending branches. Again, ascending, descending, ascending, descending, ascending, descending. Okay, so this is the profunda femoris artery. The profunda femoris artery gives off 4 perforating branches. This is the lateral lateral circumflex femoral artery, medial circumflex femoral artery, ascending branch, okay, transverse branch, descending branch, ascending branch, transverse branch, and the acetabular branch. And now the internal iliac artery continues as the gluteal artery. So see, the gluteal artery, this is superior gluteal artery. It divides into superficial gluteal artery and the deep gluteal artery. Okay, now the inferior gluteal artery divides for anastomotic branch of the inferior gluteal artery. So this is it. Now we will see the anastomosis. We saw the branches of everything. Okay, see, we have two anastomosis, trochanteric anastomosis and cruciate anastomosis. Trochanteric is on the anterior side, cruciate is on the posterior side. This is near the hip joint. Okay, this is near the hip joint, and anteriorly near the greater truncator, and this is near the lesser truncator. Okay, lesser truncator. So see, abdominal aorta, common iliac artery, right common iliac artery, left common iliac artery continues, external iliac artery continues near the inguinal ligament as the femoral artery, gives off branches. This is the profunda femoris artery, lateral circumflex femoral artery, medial circumflex femoral artery. This is its ascending branch, descending branch, ascending branch, descending branch. Okay, so these are the 4 perforating branches we saw. And see, this is the internal iliac artery, continues as the gives off anterior and posterior division. So superior gluteal artery, inferior gluteal artery. Superior gives off a deep branch, and see, deep branch of the superior gluteal artery, and anastomosic branch of the inferior gluteal artery. So the anastomosis is cruciate. So the truncatoric anastomosis is taking place between ascending branch of the lateral circumflex femoral artery, superior gluteal artery, inferior gluteal artery, and the ascending medial circumflex artery. lateral का and medial का दोनों का ascending, एक superior and एक anastomotic branch is forming the trochanteric anastomosis. The cruciate anastomosis is from the descending branch, again the descending branch of the lateral and the medial दोनों का descending branch, one from the deep branch of the superior gluteal artery, and then the first perforating ascending branch of the profunda femoris artery. So this is the trochanteric, the cruciate anastomosis. Now the longitudinal anastomosis, it is not in the detail, it is just given. Okay, located near the linea aspera. Okay, so suppose if I draw a femur, suppose this is the femur, this is the neck of the femur, this is the greater truncator, behind this lies the lesser truncator, as a gluteal line, and this line, whatever you see here, this is the linea aspera. It has two lips, that is the medial lip and the lateral lip. Okay, so it's near the linea aspera along the insertion of the rectum magnus muscle. It gives off 4 perforating branches and muscular branches of popliteal artery, ascending branch, and it gives of the 4 perforating branches again give ascending and descending branches, as we have already seen. Now we are going to study the last part of the chapter, that is the clinical anatomy, that is the semimembranosus bursitis. Okay, inflammation of the semimembranosus bursa, it causes the pain, and the bursa becomes more prominent during extension of the knee, disappears during flexion of the knee. So okay, this is called as the bursitis. Okay, semimembranosus bursitis. What is sleeping foot? When nerve gets compressed between the edge of the table and the femur, whenever the nerve is compressed, it gives a numbness, feeling of numbness and tingling sensation. It is called as the sleeping foot, and it is a temporary loss of sensation. So sensations come back when foot is hit on the ground several times. Okay, so when the foot is hit on the ground several times, so it gets decompressed and the sensations are back, and the tingling and the numbness goes away. So this is a temporary condition, that is the sleeping foot. Now we are going to see sciatica. It is the most common type of nerve compression. Okay, it is a shooting pain along the cutaneous distribution of sciatic nerve and its branches. It is called as sciatica. Pain in the gluteal region, back of the thigh, lateral side of the leg, and the dorsum of the foot. So the complete limb is affected. Okay, the gluteal region, back of the thigh, but lateral side of the leg, not the medial, lateral side of the leg, and dorsum of the foot is affected. It is due to the compression of one or more roots of forming the sciatic nerve, caused by the disc prolapse or neuritis. Okay, disc prolapse. Okay, or the herniation of the, also called as the herniation of the disc. So suppose these are the discs. Okay, so if you lift heavy weights, or if you're if it slides over, so this it the nerve between this get compressed by the it applies the pressure on the nerve, and the nerve gets compressed. So see, nerve compression occurs due to the herniation of the disc, due to which pain will be seen, and shooting pain in the gluteal region, in the back of the thigh, lateral side of the leg, dorsum of the foot, called as the sciatica. It is the most common compression of the nerve. So now we are going to see the sciatic nerve injury. See, sciatic nerve compression and sciatic nerve injury are very two different. Okay, they are different things, do not get confused. Due to the penetrative wounds, okay, due to the penetrative wounds, sciatic nerve injury can occur, like accidents, stabbing, etc. Stabbing. Hip dislocation also is a cause for the sciatic nerve injury, because we know that its cause we have seen, right? So hip and द फीमर जहाँ पे अटैच होता है टू द ग्रेटर फोरामेन, ग्रेटर सैटिक फोरामेन, वहाँ से पास होके वहीं से आ रहा है. तो अगर हिप डिसलोकेट हो गया तो नर्व इंजरी हो सकती है, जिसकी वजह से देयर विल बी लॉस ऑफ मूवमेंट्स बिलो द नी एंड देयर विल बी फुट ड्रॉप. ओके, फुट ड्रॉप विल बी सीन. ओके, लॉस ऑफ मूवमेंट्स बिलो द नी and foot drop will be seen. So can be motor loss and sensory loss. Motor loss is loss of hamstring muscles, loss of the dorsiflexion, plantar flexions, and the avatars muscles of the soles, everything. The motor sensations will be motor loss will occur. And back of the thigh में complete leg, foot, okay, हर जगह back of the thigh, complete leg. injury में different है, compression में different है, ठीक है. back of the thigh complete leg, उसमें बस lateral side of the leg था, इसमें complete leg है. and foot except the area supplied by the sphenius nerve. So see, the foot is supplied by different nerves, sural nerve, etc. So see, sphenius nerve is also there. जहाँ पे sphenius nerve है वहाँ पे injury, I mean the pain and sensory loss does not occur, only occurs where the sciatic nerve is innervated. So back of the thigh, complete leg, and the foot. Okay, so now collateral circulation. See, arterial anastomosis we saw, right? We saw the trochanteric and the cruciate anastomosis. So if the femoral artery, due to some reason, it is not pumping enough blood to the muscles and the region surrounded to it, then the collateral circulation occurs to the anastomosis. So this is the my pen. Okay, so this is about the anastomosis, and we are done with the chapter, I think. Yeah, we're done with the chapter. So only muscles are left now. It will be covered in like hardly 5 or 6 minutes in the next class. Thank you so much for watching this video. Please check out the description and check out the other videos as well. Thank you.